We're back with our On Politics panel here on Session 11. Let's take a question from you this morning. We got one chatter that says, if the state wants to invest more in public education, how can the private sector, as was suggested this morning on the panel, afford to fund health and human services? Robert?
Peggy Venable, what would you say?
You know, I think the private sector is already doing a lot to fund their own health insurance, but it's interesting to note that some major companies have asked for and received waivers from the Obama administration on Obamacare, and I think we in the state should be asking the same. The state should be able to pass, and I hope they do, an interstate health care compact that would allow us and other states to develop our own programs and not have to work under the onerous and expensive Obamacare.
Dick Levine?
Well, the question is how you can afford not to fund health and human services. Most of the money goes to support people who are in nursing homes, who have no other option and can't always go back and just live with their families. Or if the rest of it's for children's Medicaid and CHIP, which keeps these kids healthy enough so they can go to school, so our investments in public education will pay off. So, you know, that's all provided by private doctors, private nursing homes, private hospitals. So I think the private sector is playing a role, but I think just for compassionate reasons and for investing in the long-term future of Texas, we can't afford not to make these investments.
Greg Holloway?
It's called time, talent, and treasure. Every Tea Partier knows that one of our prime responsibilities is personal responsibility, not only to take care of ourselves and our family, but to take care of those in the community that can't. So we need to get off the couch, to get out and volunteer in the schools, volunteer in the healthcare clinics, give money, give time. There's no other way around it. Government can't do it. It's a structural imbalance.
Senator Davis.
Well, I think that's a beautiful concept, and I wish we all would involve ourselves more. But for now, at least, government bears the primary responsibility for taking care of the health care needs of some of the poorest among us. And in the state of Texas, compared to what other states are doing across the country, we are spending the least in terms of how we supplement that care. When we talk about taking that amount, spending the least, and ratcheting it back dramatically, it truly does have an impact on people in nursing homes, children in our children's hospitals. Our Medicaid reimbursement rate, what we pay to doctors who see Medicaid patients, is the lowest in the country. And as a consequence of that, fewer and fewer and fewer doctors are offering their services to the poor. Because that is the case, our hospitals are bearing an undue burden in terms of the people who are coming in to see them. And we're talking about cutting dramatically $10 billion from their funding. Our hospitals are asking us a logical question. What will we do? We won't be able to see these patients anymore, and we won't have the doctors in the private sector who are seeing them and taking some of that workload off of us.
We're going to have to leave it there. We thank you all for coming in this morning. Appreciate hearing your views. And if you missed any of our discussion here this morning, the video will be online later today. Just log on to KXAN.com, and while you're there, click on the On Politics tab at the top. You go straight to our special political site where you can check out our latest coverage, previous broadcast programs, and more. And now the results of this morning's On Politics poll are in. We asked you, without a state budget set, are districts moving too quickly with teacher cuts? 70% of you said yes. And finally this morning, there's something to celebrate across the state of Texas this week. On Wednesday, Texas will turn 175 years old, the day we became our own country. Everyone born here has been taught that on March 2nd, 1836, Texas declared independence from Mexico. It would be fascinating to have the 59 signers of the Declaration of Independence teleported from 1836 to present-day Texas to see how their vision of Texas turned out. No doubt they would be shocked and stunned on a number of levels. This Wednesday, you are invited to a special memorial service for the veterans of the Texas Revolution beginning at 9 a.m. at the Texas State Cemetery in East Austin. Reenactors in period costume will fire a musket volley to honor the great state. Then on Saturday, the annual Texas Independence Day Parade kicking off at 9:30. The bands and floats beginning the march up Congress Avenue to the state capitol. Thanks for joining us. Meet the Press coming up next.